I'm Dr. Joshua Kain. I'm a head, neck, microvascular, and reconstructive surgeon. Today I'm going to be talking about the postoperative management of your surgical incision and scar. This is really important. Patients always want to get the best scar that they possibly can and always want to know the things that they should or shouldn't be doing that can lend to that. Today we're going to talk about 3 phases of management of the acute or immediately postoperative surgical incision. The acute phase of healing. During these first 3 days right after surgery, the main important point is just to keep the incision clean. Any dirt or any materials that get within the incision line can potentially set up an infection. So the way that we prevent that from happening is by keeping a thick coat of ointment over the incision lines, which includes over the staples or sutures or however the skin may have been closed, so that this traps any dirt or any material that's trying to get within the wound itself, within the ointment. It also hydrates the skin so that the skin can heal appropriately. And then it also has topical antibiotic within it so that it penetrates those very superficial layers of skin and prevents an infection from setting up and developing. During these first 3 days, there's no cleaning required for the incision lines. You don't need to apply alcohol or hydrogen peroxide or any specialized wound cleaning solutions, as this will actually go underneath the skin and get into the wound itself. And so this is not necessary during those very early first few days after surgery. What should I look out for right after surgery? First thing is something called a hematoma. A hematoma is where blood under pressure develops underneath the skin. This looks like a firm bulge or a firm knot underneath the skin. If this develops for you, this is something that you want to notify your surgeon about or notify their office. What are restrictions in this early period right after surgery? We ask that you do no heavy lifting, nothing more than 10 pounds. We also ask for the same reason that you avoid any strenuous exercise, such as sprinting or lifting weights or anything that causes you to exert yourself in high demand. You may continue to walk and mobilize, and in fact, you're very encouraged to do so. Phase 2, days 4 to 10. This is the point in your incision's healing where it's still very important for the incision to not be under any tension or strain, so you're still avoiding heavy exercise or heavy lifting, but this is the period of time where the incision is starting to gain some rigidity and some stability. You're still applying topical antibiotic ointment for the same reasons that we talked about in phase 1. This is the point in the incision's healing process where we do have to be mindful of signs and symptoms of an infection. The main things to look out for during this point to monitor for infection are areas of new redness or increasing and intensifying pain at the incision site, or especially if you see discolored or foul-smelling drainage that develops from the incision site itself. If any of these things occur for you, these are things that you want to notify your surgeon and notify their office about so that these can be addressed in timely fashion. Phase 3. While you can still develop an infection during this phase 3 time period, it's much less common than during the second phase of the healing. And so you should still be on the lookout for signs and symptoms like we talked about earlier in the video and notify your surgeon if any of these develop. But we can start to take a breath and say that that incision is starting to reach a point of stability. We ask that you continue to use just a hydrating ointment at this point. You no longer need the antibiotic ointment, but instead just need a hydrating ointment such as Aquaphor or plain Vaseline. This will be applied on a 2 to 3 times a day basis directly over all the incision lines. During these first 6 weeks, it's very important to keep that incision out of the sunlight so that the incision line doesn't darken or redden, and also to prevent heavy tension or pressures on those incision lines. This incision is still fragile during these first 6 weeks after surgery. By this point, you can oftentimes shower and let soap and water run over the incision lines. It's important to use a shampoo or a body wash that doesn't have any strong perfume or fragrances or any lotion or moisturizer within it, but something that's just very easy and mild. We oftentimes will have patients use baby shampoo or something that is bland and antibacterial in nature so that the incision lines are staying clean, but they're not getting any foreign materials that could set up allergic reactions or things along those lines. I'm Dr. Joshua Kain. This has been a video on the instructional care of your incision after head and neck surgery. This is not meant to be a substitution for the specific instructions given by your surgeon after your procedure. Please continue to adhere to any instructions given by your surgeon in their office after surgery. However, we hope that this has been an educational piece for you, and if you'd like to see more content of this nature, please like this video and be sure to leave us a helpful comment below.